Hi winners, I'm back again with part 5 of NEET MDS 2025 recall. Yeah, we'll try to discuss as much content as possible and make sure if you watch this video, if there are any mode of corrections in the question pattern or the options, do let me know so that I can finally conclude the final answer, and I'll be providing you the PDF format of this. Okay, so please do let me know through the WhatsApp or through the comment box in the YouTube or the Instagram, wherever it is being uploaded. Okay, so it's going to help my upcoming students as well as my team to focus on what to be discussed for the next couple of years. Yeah, coming to the question, which of the following is considered as a disadvantage of inlay wax? Okay, I don't want to talk much about this. Just straight away repeat. Straight away, the question was straight away repeat from the operative dentistry 2025 paper. Okay, as I said, like, hope you guys have done the subject specific, even if you missed the topic specific. Our 2026 batch people who are watching this video, every question on the website is very, very important. Every question on the website is very, very important. If you're not able to if you're not able to reach out to the right answer, not able to understand, let me know. Okay, throw to me on the WhatsApp. We'll be discussing that on the group. We'll be giving it repeatedly on the exam. This is how the integrity you have to maintain with the mentors over there. Okay, right? So this is your operative dentistry 2025 question which is given in the exam. Straight away, of course, this is a repeat. Okay, straight away the answer is A. Okay, again, I'm jumping into the next part. Resistance to the cutting of the enamel with bladed hand instruments is regularly seen associated with which structure? Dental histology, grand enamel. Okay, of course, right? So makes the enamel tough and resistance to fracture. Straight away discussed in your bootcamp series, dental histology by me. The answer for this question is B. I want to go a little bit fast because this is not basically discussion part. I'm just trying to find out the exact options and want to give the reference exactly where I have discussed. I just want to show the work that Mdsconquer has done this year, work that has to be noted. The main reason of preparing the series of videos by Team Mdsconquer. Again, a 50-year-old patient presented to the dental OPD with a complaint of tooth sensitivity. Clinical examination reveals heavy occlusal loads. Key point to be noted. Heavy occlusal loads and wedge-shaped defect on the facial surface of the maxillary premolars. Okay. So, of course, you guys know the answer. The answer is A. Yeah, this is straight away question from NEET 2020 paper, which was discussed, which is there on the website. Similarly, they have given wedge-shaped defect, cervical region of the tooth due to the occlusal load leading to the microfracture of the enamel. Okay, right? The answer is abrasion. Right, it's there on the website, and I hope most of you have practiced. Which of the following trace element is strongly associated with promoting the dental caries? Okay, right. The answer is, of course, there is a little bit of controversy. B and D options are right, but if you want to choose between B and D, I strongly recommend D is my final answer, which was discussed for you. Okay, that too in the bootcamp series I have discussed in the last couple of days. On the WhatsApp activity also I have discussed. I have given the code MSCSLP. Okay, right? Familiar. Again, the next question is again straight away question from your GT. Okay, discussed straight away question from your GT. Okay, so that is basically they're asking like bonded abrasives. Akshay sir has discussed again. You see, finishing and polishing videos, you see how many questions are there. Bonded abrasives are discussed. All the 4 options are related to bonded abrasives, out of which they're asking the strongest. Sintered is the strongest, which we have discussed. Okay, right? So nicely it was covered and discussed. So in electroplating process, to obtain an electroformed die, the impression material surface is covered with silver. It is done to which of the following? The main purpose of why we are doing electroplating, is to make it hard. Impression is to make it hard, right? Is it make it abrasive resistance, right? Okay, so both A and B are also right. Okay, according to me, A and B are also sounds to be right. But this hardening or abrasive resistance can be seen with majority of the things. We do many things, many modifications are done, cyanoacrylates are done, or else like we are going to use more strength gypsum products. Everything we are making it hard and we are making it more abrasive resistance. That is the story. I'm okay with that. But the main reason that is focused on electroforming. What is electroforming doing? Electroforming is increasing the flow. You see, examiner has given two options opposite to each other, going in opposite direction. One option is increasing in the flow. One option is resisting the flow, decreasing the flow. Whenever two opposite options are there, the answer logically could be among those. Okay, so my answer for this is to increase the electric flow. And of course, it was well discussed by Gauri sir on the bootcamp series, and of course it was discussed by me in pro lives as well as in the offlines many times. Each and every line I made you to read, I made you to write the notes in the offline as well as in the pro live related to this electroplating directly from your dental films, because so many questions. What is anode? What is cathode? Where is deposition occur? What is throwing a powder? What is cyanide chamber? What is the amount of electricity that is required? Whatnot we have discussed. Okay, electroplating dyes are very specific to which impression material, polysulfate, everything we have discussed. Yeah, of course, a basic common sense based question was given, and I hope you guys have done it well. Then a patient requires a 3-unit metal ceramic bridge in the mandibular left posterior teeth, has a severe gag reflex during the impression. The impression material which is appropriate to this particular individual. It is just basing upon the setting time you have to take into considerations. Of course, clearly, nicely discussed by me in the video. Okay, setting time is least for. So among the options, setting time is least for addition silicone. So you have to go for addition silicone as an answer. Option 2. And I clearly told in the last 10 days, guys, this discussion video is very, very important. I told you 100 times this video that most of you are familiar. 15 minutes rapid revision impression materials video. Okay, because basic concepts of impression material most of us can handle. Sulfur, yeah, I can handle that. Sulfur related latex gloves, yeah, those concepts I can handle. But revision part, number based questions, I told you number based questions are very, very important in the exam. I told you to revise in this last 10 days. Brush heap structure is seen in straight away, agar again from the same video. Brush heap structure straight away, agar from the same video. Next one, which of the following is the correct sequence of linear contraction of elastomeric impression materials? Option A, straight away, again from the same video. Most of you are familiar. Hardening solution is added to, agar again from the same video. So that's what I'm telling, like it's always important, whatever, like wherever you read. Okay, my golden suggestion. Okay, most of the mentors in the country who are having great experience are really extraordinary in guiding the students. Wherever you're there, you are in the right hands. Okay, you are in the trustworthy hands. So whenever we travel, like yesterday I was traveling. Yesterday I traveled to my hometown. Straight away I'm in my hometown. So I traveled from Hyderabad to the airport by a cab, and then I traveled by a flight. Then I have reached my place again by a cab. Okay, so in this process I have to trust the people. The cab driver, I have to trust him because he is driving me. My safety is in his hand. I'm traveling on a bus. Yeah, I have to believe the driver because my safety, my life is in the hand of a bus driver. Right? Why I entered this cab? Why I have chosen this cab? Because I have trust on this. So similarly, when you are preparing for an entrance exam, I strongly recommend, because things are getting tough. Entrance examination question papers are getting tough. These question papers, whatever I'm discussing, yes, I'm proud to show that I have discussed the related content. A straight away question came from my content. I'm proud to say that. But even when I'm proud to say, these questions are not easy. These questions are not straight away. Maybe brush heap structure is a straight away question. I'm happy for that. But rest all the questions, they require you to get focused in the examination. You to sit, understand the question, check out the options. Imagine a patient is coming. You see this question, hydrofluoric acid, hair side assistant, came in contact with the skin. What to be done? It's a clinical based question. So all these questions, they require proper orientation. That's what I'm telling. Like preparation always requires a proper orientation, which is always given by the mentor for most of the students. But I'm not talking about those 10% of creamy students. okay, who can understand this. They have the ability to understand this. I'm not talking about those 10 or 15% of the creamy people. I'm more worried about those 85% of the students who don't have this orientation or the basics in their college, which you need to develop those orientations in the limited time. In this limited time, whatever the time that is available, we need to develop that orientation, read, understand the concepts, revise the concepts, mug the concepts, practice the MCQs, revise them and again, and do your best in the examination. Is not at all difficult. That's what I'm telling people who has given exam. Yeah, it's great. You're extraordinary, really great. And people who are going to come out with a successful result, let it be any rank. According to me, it's not about 100 below, it's not about 200 below or 300 below or 400 below where you get a GDC. Every rank is an appreciating rank. Okay. I strongly remember the greatest experience I got, the greatest appreciation I got in this last 10 years was a student who got 4,000 odd rank. The student who got 4,000 odd rank, okay, a woman who has prepared for an entrance exam when her son is preparing for an UG entrance. Mother is writing PG entrance exam, where the son is writing Neet UG exam. Both of them are preparing in the home and both of them has cleared the exam. Son has joined MBBS and mother has joined MDS. And you see the happiness of the woman on the day of result or on the day of college joining. The greatest happiness what I have, how she was experiencing MDS CONQUER, how she was showing her gratitude on the day of college joining was the most happiest thing that has made me. Of course, we got All India second, we got All India third, we got All India fourth at the very initial phase of MDS CONQUER. We got so many state oriented ranks. Okay, I'm happy for each and every one of you, but most happiest gratitude oriented message or the call or the meet that I had is with this woman who got 4,000 rank. So according to me, every rank is a rank. Okay, if you're joining with that particular rank to your college, let it be a deemed college, let it be a private college, let it be a government college, rank is an appreciation. Rank with which you have joined is the greatest rank that in your life. That's what I'm talking. Like yesterday I was talking to students, toppers. You are topper, I am topper, everyone is topper. For example, you are the only one who has been into the medical profession from your entire family. I'm the first one, followed by my brother. My cousin has taken the medical profession. So we are toppers of the entire family. In our family, we are toppers. Maybe I'm not the topper of my batch. Maybe I'm not the topper of my college. Maybe I'm not the topper of my entrance examination. But I am the topper of my family, who has done so much in education field, who has done so much in the medical field. I'm the topper there. Maybe I'm the topper among the dentists who are from my hometown, who are from my village. Okay, in some aspects at least. Okay, so every one of you are topper at one level, a school level or a college level or a university level or a village level or your small family level or a big family level. Okay, so toppers, all of us are toppers. Okay, but that's what I'm telling, like there will be creamy students in the preparation phase. Okay, of course I'm not addressing those people. I'm more worried about student like me, okay, who is above average but not able to enter into the creamy zone, but dreaming to be in the creamy part. Okay, right? I hope you got what I'm basically trying to exchange my ideology over a period of 10 years. What my ideology on the day one is different. What my ideology, once my first batch students came out, like on the 4th year, my first batch students came out. So once I'm talking and interacting with my first batch students who are finishing after MDS, then my ideology was different. Basically, like in the first 3 years, my ideology was just like a PG. My orientation was just like a student, guiding my students. But once my students were out, my first batch students were out, then interacting with them, then the ideology has been changed. Over 10 years, now 10 years done. Now how I talk, the way I talk, you can check out my old videos, which were uploaded 10 years back. The way my talkings were slightly different. Now I feel like after 10 years, I got that maturity enough to speak in front of the crowd. Okay, right? So what my suggestion for all of you is, most of you are in the initial phases of your dental life, okay, done with BDS and planning to enter into MDS. My suggestion for all of you, it's a time of maturity. It's a time of exposure. Whenever you are giving chance to yourself to get more exposure from the patients, from the materials, from the college, from the students, from the people around you, then your maturity levels are going to increase. So that is my golden suggestion for all of you. So don't sit idly at one place. Don't sit idly at the department. Don't sit idly chit-chatting with your friends. Go interact with the patients, interact with the co-PGs, interact with the interns, interact with the final years, interact with the second years. Help them. So this is all going to give the process of maturity. I still remember when I was a second year PG where I'm addressing the preclinical conservative of second BDS students. It's a good chance to interact with a very young dentist. So take the privilege. Okay, you don't feel that what I'll get if I'm talking to a second year BDS or a third year BDS. You are not going to get anything financially, but you are going to get that maturity in the life. So whenever you get that maturity, everything looks very simple, right? So chalo, I'm done for now. We'll be coming up with the next part very soon. Maybe in the next couple of parts I'll be discussing subjects which I have taken, maybe perio, pedo, pharmacology, and of course on the other hand Pritisha ma'am is going to take few more discussions. So stay tuned to the YouTube channel for further more updates regarding NEET MDS. Okay, so yeah, I told you, right, the golden number, helpline number. Of course, I hope you guys have my number too. So you want to register or you want to get some info, so you can directly ping to this number. Karan sir will be available on this number to address you, to guide you to which plan to choose. Again, choosing a plan is also very important. What fits for you, basing upon your convenience, basing upon your commitments. That also my suggestion. That's also, don't decide any plan basing upon the financial numbers. Okay, decide the plan basing upon what you require from the team. Okay, right? And of course, we are going to resume the offline classes, okay, with a proper organized pattern and schedule, and with cabin-based study rooms and everything. And our offline center is only available in Hyderabad. Okay, it's only available in Hyderabad. If you want an offline classes, you have to reach out Hyderabad. And after reaching out Hyderabad, your safety oriented to your preparation, or your preparation is my guarantee. Okay, because I'll be having 100% focus on you if you stay in front of me. So you're answerable, questionable for everything in the offline center. Okay, right? So that I hope like what I mean. Okay, so yeah, we are going to resume the classes probably once the result is out. Okay, and yeah, we are waiting for the repeaters to come and resume the classes. Like once the result is out, we are going to announce the exact date. But the admissions, that's what I'm telling. The admissions were open, study room is open, so you can access the study room and you can start your preparation. Okay, so done for now. Take care. See you very soon. Bye. See you.